phone messages and stuff because she knows I don't enjoy them. So she's like, it doesn't bother me at all.
Oh.
Right? So little things like that she's already mentioned, but that's why she told me flat out.
All right, 10
Okay.
seconds here.
Okay,
Good news, I guess.
so put a proposal together. Okay.
And a big thank you to Desert Financial Credit Union for sponsoring the KRIM Community Spotlight Program. Good morning, RIM Country. Hope you're enjoying the nice, cold, white, slippery morning out there. Yes, it was a little slippery this morning, early in the morning, but I think the ice on the roads, the snow has been melting. Thank you to all the road crews that have been out, the Payson Streets Department, ADOT, the county. Thank you for clearing the roads and making them safer for us to drive on. Well, in the studio this morning, we're going to be talking to a couple members from the Payson Warming Center. We have Board President Dorine Prine in the studio, along with Director of Operations Skyler Brice. And we also are on our KRIM FM Facebook page, streaming live, so you can check in there. You can watch us, you can see us this morning and ask questions on our live stream if you have any, or just say hello from wherever you're watching. So guys, thank you so much for coming in this morning, braving the elements, because it's chilly out there.
Thank you very much for having us here.
Oh, you are so welcome. It's great for you to come in and share with our listeners and viewers about the Payson Warming Center, just everything you do there, everything that you have going on, and everybody that you work with in the community. I think there's a lot of people that don't realize the extent of your operations, just everything that you do and everybody that you work with. So today we're going to be, sharing that, going over, all of the collaborations you have and the partnerships you have here in the community.
And we have a lot of them. There's a lot of community and organizational support and collaboration between all of us, and that's the only way that, we're a small town. And so working together with everyone really works out really well. We have a great relationship with the Payson Police and Fire Department also. So we're doing a lot of different things with different organizations, also with the Payson Christian Clinic. And we have an intern that actually comes in to be able to help provide physical health. We have NAMI that's also doing things for mental health. Not to mention the other thing that we've got a lot of different programs that help people. So we're not only giving out food 365 days a year. Yes, Christmas, Thanksgiving, all of those holidays, we still serve everybody food. And it's a hot, nutritious meal, and it's free. It's open to the public, which with these economy, that's increased a lot. We used to, at the beginning, serve like maybe 15 people, and we're up anywhere between 40 and 50 people per night now.
Per night, wow. So going back to, because I want to really go into a little bit the role of the Warming Center. So when you said the relationship that you have with the Payson Police Department and Fire Department, how do you assist them, or what does that look like, Skyler?
Sure. So first and foremost, we started about 3 years ago. Our 501c3 was filed on December 15th of 2019. So we opened right before COVID. We work on a hub and spoke model. So the goal is to figure out what everybody is doing already and to try to work alongside them. So we work with dispatch. Also, my cousin is dispatch for Gila County, so she literally can call me sometimes. So it's nice being a local and having family here. But working with the police directly, we're able to, sometimes they can just walk in and show our staff a picture of someone and see if anybody here has seen them or recognize the person.
Yes.
Other times we have the person they're looking for sleeping in the bunk right now. Last night there were 9 people at the bunk. 2 nights ago, someone who was sleeping in the bunk, the police were looking for that exact person. So we just let them in. Everything was very cooperative. No hostility, because they had gotten some rest and they trusted us. We weren't trying to feed them to the wolves. We're trying to help them. So
they also, the police department will also call Skyler.
Yes.
Sometimes 2 or 3 o'clock in the morning, saying, "We have this homeless person, and if you can help them, it's better than us booking them and
Yes.
giving them a police record.
Mhm.
So if you can do something, it's a lot better for the
Mhm.
person, because we don't want to have to put them in jail or anything and give them a police record like that.
Yeah, it's better for everyone. It's
Yes.
better for the police department because then they don't have to process that person. They don't have to go through all that. And most likely it's for something that is
Usually petty.
petty.
Very.
So,
yes.
Not
to-
always, but sometimes.
yes, but to have the warming center and have you, Skylar, and others as a resource, then that is valuable to them.
And she mentioned the Christian clinic. So they have, that's Dr. Hunt, and she has about 11 medical students under her. Most of them are from ASU, and I think one or two are from up north in NAU.
Mhm.
They're basically at my beck and call. If I beg them to come, they will usually leave unless they're in the middle of a surgery to come help us. They're able to write prescriptions and things because Dr. Hunt can give the referral, and get people who have real authority and distrust towards people,
Mhm.
give them hope and let them actually have a chance of being encouraged towards wanting to receive help, which is extremely hard.
Something that you mentioned on one of the previous programs when you were in is that individuals that have some mental illness or challenges, or they haven't had medication, maybe that there's some people that have been without medication that they need. So the Payson Christian Clinic, it sounds like, provides the opportunity for them to get that medication so they can get balanced,
Yes.
get in a better mental state, and then it's easier to talk with them to kind of
So
explain.
on the mental
Yeah.
health side, our county simply lacks a lot of the resources that most of the people in the modern world take for granted in our country. We don't have a 72-hour bed, like a mental health hold bed.
Mhm.
I'm serving as that right now. I do the trainings for the people who do that. I'm not actually even qualified.
Mhm.
I just have staff. I'm working with the crisis team, or I'm working with medical students so that we have the proper documentation and we're able to help people. But there's also some laws that have been made in our county that have no precedent. Persistent acute dysfunction. If someone is persistently putting themselves at risk, maybe they're not a danger to themselves or others directly because they can articulate to you, I don't want help. But then they're freezing to death and they're not eating and they're not sleeping and they're so out of whack with themselves, they don't know they need help. So sometimes it takes just encouragement. The CAP office, other organizations, the ladies there are magnificent. The DES at work, Lori, all those people, they go above and beyond their call, because when they get an opportunity or they see someone goes, oh, you care about me, sometimes they can give that referral. So that warm handoff, that referral, that is where most of the magic happens right now in the community.
And another organization you mentioned, because again, I want to give some time to each
Please.
of these organizations
Yes.
because of the important role they play. NAMI. You're very involved with NAMI, and they recently have acquired
Finally.
a building. Yeah,
Yes.
MHA Foundation, allowing them to be in their old building off of Arrow. And I always get confused because then it turns into Continental.
Yep, exactly.
So,
Real quick, right by the hospital.
right by the hospital, but right off of Arrow. And with that facility, now you're able to bring back all the classes.
Yeah, I don't have to beg for a room. I don't have to change the room because the college decides to start up a class in the room we're using.
Yeah.
Like I'm very grateful for those things, but to have our own place for the mental health services, and also our Warming Center program, it's 365, like Dorine said, and it's from 4 to 6:30 every single day. If the weather is inclement, that is when the bunkhouse opens. We also have the Red Cross contract, so if there's an evacuation or a disaster, anything like that, mayor or the town manager can declare state of emergency or whatever, and we get the first 150 bedded people. We're really just trying to prevent those things from happening, or be able to respond as quick as possible when they do. That's our main goal.
So NAMI, those classes and everything that's being offered, it's great because now people that are coming into the warming center, you can share that with them.
And our
let them
volunteers can
know.
get trained. Peer support specialist training. We have people who are kind of up, who have realized that when you're trying to get a job, they ask for 4 years of work experience or a bachelor's degree. Well, how can I get 4 years of work experience? if you want, there's like a catch-22 in the system, and people are starting to finally do something in this area about that, especially up to the White Mountains. So finding other communities that are succeeding and sharing and collaborating with them. We were talking before we turned on about being local. Sometimes being local does mean northern Arizona.
Yes.
Sometimes it means all of Arizona. Sometimes it just means the southwest region of the United States. Sometimes it means the United States.
The entire country.
So
Yep.
it local depends on what problem you're trying to solve. And right now we're solving a very hard problem. The homelessness problem is completely out of hand across the country. Even in our sister country up north, their mental health crisis is very dire. They have a medical assistance in dying program, and it's aimed at their homeless population. So it's they're euthanizing their homeless people because they lack personhood, and they're doing things that are setting a precedent that we cannot follow. So we need to take a stand and be caring and encouraging. That's why Community Action Program. I'd like to go over to the pit count right now, just real quick, because it happens to be today, and I'll let Dorine kind of explain.
Yeah.
There's been a black hole sometimes. People here know the problem, or maybe they turn a blind eye to it, but when the feds look at us, they sometimes see only 6 or 10 people in the county as homeless. That's what they see. They think that's real.
That's not accurate.
No.
And also, you have a lot of experience with Community Action Program, CAP, having worked for the CAP program or
I'm
office.
retired from there now.
Yeah.
So I still keep in the community a lot.
Yeah. Oh, yeah. No. So you're a great resource. All the knowledge, information, the contacts you have.
Yep.
So
Thank you.
share a little bit how the Warming Center has been working with CAP.
Well, a lot of resources, a lot of things like they'll refer people over to the CAP office, and the CAP office has a huge amount of resources at their fingertips to be able to help people, put them in housing, do whatever it is that they need to be able to do. But one of the big things is that Gila County is doing the PIT count, which stands for point in time count. And as Skyler was saying, it's what the government HUD is looking at for us to determine if we really have a homeless problem or not. We know we have a homeless problem. The problem is making sure that they're all counted, because otherwise then it was ending up that Gila County would have like a 0.01% of homeless, and it's like they're laughing at our numbers. So with the point in time count, what it is it's where you were as of like tonight, the 24th. So where were you sleeping? Where were you staying? Were you housed? Were you or were you homeless? Whatever. And so with the point in time count, what we do is we have a survey and we have incentives that we give to people. So please answer some of our questions. And it helps us to be able to determine what caused their homelessness, what is some of the issues with their homelessness, how long have they been homeless, but mainly just really counting as to how many homeless there really are. So that's going to be happening at the Warming Center. That will be starting as of tomorrow afternoon, as soon as they open. We do have volunteers for that. If you do want to volunteer, please get a hold of either the CAP office or Skyler, either one, probably the CAP office, and they will set you up there, because there's a little bit of training, because you need very little training. And there's also confidentiality form that has to be signed. So anyway, the main thing is trying to be able to make sure that all of the homeless are counted. And that's really important. And even if they weren't homeless and we're filling out the sheets for them, they can't be counted for as homeless for HUD, for the federal program. But at the same time, there's a lot of data that we can use from that to be able to find out, especially if they're youth and they're couch surfing, doing anything like that, so that we have other resources. And that's the main thing with the PIC count. The higher, that sounds kind of bad, but the higher the count, the more resources and the more funding that we can actually receive in from local, state, and federal governments to be able to help us with our endeavors to be able to do something with the homeless.
And I'd like to give quick numbers of last year, because I know we did them recently. Dan Waters helped us through our data, so we had a third-party guy able to kind of give us very clear rough draft of what it is, we served just at 9,000 people in the year 2022. That's almost the exact same numbers of both food banks. All three of the front-facing organizations, our counts for the year was about 9,000 people served, which very drastically different from what the data shows on there. Another thing that you can always track is the overdose rate. And the paper, even I think last paper on Friday, right on the front page, it mentioned we are more than double the state's rate. And that is because we lacked resources for so long. It's not one person's problem. It's people being unaware of how these large systems work. You need to get in the stream, work with them, play their game if you want to be able to do that.
So the survey, this starts tomorrow,
Yes.
you said, and the hours that people can go in are what hours?
From 4 to 6:30.
4 to 6:30, and then how long is this going to continue?
We will do that